Leptospirosis is an communicable waterborne disease. Look at this picture, shows that disease transmission cycle and disease mechanisms. A detail going on. Introduction. Leptospirosis is a widespread zoonotic disease caused by bacteria of an genus Leptospira. It affects human and animals and is more common in tropical and subtropical regions, especially after heavy rain or floods. Transmission typically occurs through contact with water or soil contaminated with the urine of infected animals. Definition. Leptospirosis is an acute bacterial infection caused by Leptospira interogens, which may result in a range of symptoms from mild flu like illness to severe complications like kidney or liver failure, meningitis, or even death. Etymology. The word leptospirosis comes from the Greek word leptos, meaning thin, and spira, meaning coil, referring to the bacteria's thin spiral shape. The suffix osis denotes a disease or abnormal condition. Types. Leptospirosis can be categorized into two broad clinical forms. One, anesoteric leptospirosis, 90% of cases, mild from with flu-like symptoms, may include headache, muscle pain and fever. 2. Icteric leptospirosis, Wells disease, 10% of cases, severe from with liver and kidney failure or involvement, may include jaundice, bleeding, and organ failure. Look at this picture. Types of leptospirosis. Causes caused by spirochete bacteria from the Leptospiro genus. Transmitted via 1. Connected with urine of infected animals, rodents, dogs, livestock. 2. Exposure to contaminated water or soil. 3. Entry through skin cuts, abrasions, mucous membranes. Look at this picture. Risk factors. 1. Occupational exposure, farmers, sewer workers, veterinarians. 2. Recreational activities, swimming, rafting in contaminated water. 3. Poor sanitation. 4. Flooding and natural disasters. 5. Living in tropical or subtropical climates. Complications. 1. Kidney damage. 2. Liver failure. 3. Meningitis. 4. Respiratory distress. 5. Cardiovascular complications. 6. Septic shock. 7. Death if untreated. Look at this picture. Complications, kidney, liver. Pathophysiology. Here the step-by-step pathophysiology of leptospirosis in a clear and organized way. Pathophysiology of leptospirosis step by step. 1. Entry of bacteria. Leptospira bacteria enter the human body through skin, abrasions or cuts, mucous membranes, eyes, nose, mouth. Ingestion or inhalation is rare one. 2. Leptospiremia, bacterial spread in bloodstream. Once inside, the bacteria enter the bloodstream, causing leptospiremia. Bacteria multiply and spread to multiple organs. 3. Tissue invasion. The bacteria disseminate to organs such as the liver, kidney, lungs, and central nervous system (CNS). They invade tissues, especially small blood vessels, capillaries, causing vasculitis, inflammation of blood vessels. 4. Host immune response. The body activates both innate and adaptive immune responses. Antibodies IgM than IgG are produced to fight the bacteria. 5. Organ dysfunction. First, liver inflammation caused jaundice, Bell's disease. Then kidneys. Tubular damage leads to acute kidney injury and electrolyte imbalance. Then lungs. Capillary damage may cause pulmonary hemorrhage or respiratory distress. CNS may result in aseptic meningitis, heart, myocarditis, and arrhythmias can occur. 7. Immune base. After 4 to 7 days, bacteria are cleared from blood but may persist in organs like kidneys. The immune system may cause further inflammatory damage to tissues. Autoimmune like effects. Look at this picture, pathophysiology, organ damage. Recovery or progression with treatment. The infection resolves and organs gradually recover. Without treatment, complications like multi-organ failure, hemorrhage, or death may occur. Signs and symptoms. A. Early phase, acute septicemic phase. 1. Sudden high fever. 2. Chills. 3. Muscle ache, especially cough and lower back. 4. Headache. 5. Red eyes. 6. Nausea, vomiting. B. Immune phase. 1. Meningitis like symptoms. 2. Jaundice, yellowing of skin and eyes. 3. Kidney dysfunction. 4. Skin rash. 5. Bleeding. A diagnosis. 1. History and physical exam. 2. Blood test including complete blood count CBC, liver and renal function test. 3. Serologic tests including ELISA detects IgM antibodies, MAT microscopic agglutination test, gold standard. 4. PCR detects bacterial DNA. 5. Urine culture in later stages. Nursing diagnosis. 1. Risk for infection related to exposure to contaminated environment. 2. Altered comfort, pain, fever related to systemic infection. 3. Fluid volume deficit related to vomiting and sweating. 4. Risk for impaired skin integrity related to rashes or immobility. 5. Anxiety related to hospitalization and unfamiliar environment. Medical management. 1. Antibiotics including doxycycline mild cases, penicillin G or ceftriaxone in severe cases. 2. Supportive care including rehydration with IV fluid, electrolyte correction, dialysis in renal failure, oxygen therapy if respiratory distress. Nursing management. 1. Monitor vital signs and intake, output. 2. Maintain fluid and electrolyte balance. 3. Administer medication as prescribed. 4. Educate patient and family on hygiene practices. 5. Provide emotional support. 6. Monitor for signs of complications. 7. Implement infection control measures. Treatment options: 1. Mild cases, oral doxycycline or amoxicillin. 2. Severe cases, IV penicillin, ceftriaxone or cefatoximine. 3. Supportive treatments, dialysis, mechanical ventilation if needed. Nutritional support. Psychosocial medicine: 1. Counseling to reduce anxiety and fear about illness. 2. Support groups connecting with others who have had the disease. 3. Health education on disease transmission and prevention. 4. Stress management, breathing exercises, relaxation techniques. 5. Family involvement, involving loved ones for emotional support. Prevention: 1. Avoid swimming in potentially contaminated water. 2. Wear protective clothing and boots in high risk jobs. 3. Control rodent populations. 4. Proper sanitation and waste management. 5. Vaccination for animals in endemic areas. 6. Prophylactic doxycycline during outbreaks or for high risk exposures. In conclusion, leptospirosis is a preventable yet potentially life threatening disease. Early diagnosis, timely antibiotic therapy, and supportive care are crucial to reduce morbidity and mortality. Public health measures like sanitation, rodent control, and education are key to prevention. Nurses play a vital role in early detection, treatment, support, and health education. Thank you. Have a nice day.